Ever wonder why you find yourself having to go to the bathroom more often, or how you have to go when your body says you gotta go and you can't hold it on any longer? Well, it's a condition called an overactive bladder. The term overactive bladder, or OAB, describes a group of bothersome bladder symptoms which include urgency to urinate, nighttime urination, and frequent urination. It's more common than you may think, affecting nearly 1 in 3 men. Now, most men develop symptoms as a result of one of two ways. One, from an enlarged prostate that causes blockage of urine flow, or two, from scar tissue formation buildup in the bladder, neck, and urethra, which is common after radiation therapy. Now, this enlargement of the prostate occurs naturally as men age and is called benign prostatic hyperplasia, or BPH. The larger prostate compresses the urethra, resulting in forcing the bladder pump muscles to work harder to empty, and as a result, it becomes overactive. OAB commonly exists prior to prostate cancer treatment, or it may develop as a result of it. One of the treatments for prostate cancer includes radiation therapy. The radiation, although direct, affects the prostate and surrounding tissue. This often leads to scarring in the bladder, neck, and urethra, causing a blockage or obstruction to the flow and difficulty emptying. The result in causing the bladder to forcefully contract to fully empty. Now, the best way to overcome and manage overactive bladder is behavioral changes. Now, without proper education, other behavioral modifications in physical therapy may fall short of their potential. First, let's review some of the lifestyle changes that will help you. Now, as a general rule, fluid restriction is not an advisable means of dealing with OAB and urge incontinence. Limiting fluids will actually make the urine more concentrated, which can cause bladder irritation and actually worsen urinary urgency. Selective fluid restrictions are appropriate in certain circumstances if indicated by your physician. For example, someone who is taking excessive fluids should be encouraged to cut back. Someone who suffers from nighttime urination might be advised to cut back on fluids in the evening. The problem is most men translate this to cutting back fluids throughout the entire day, which again, it's not advisable. You want to make sure that you are still getting in the recommended amounts of fluids that you need just earlier in the day. Now, the exact amount of fluids that you need may be different from somebody else, so make sure that you're following what is recommended for you. Now, without knowing how much is recommended for you, a quick way to know that you are well hydrated is if there is little to no color in your urine. Now, instead of limiting fluids altogether, what you want to do is avoid fluids in drinks that irritate the bladder. Here I want to show you a chart of drinks that are known to cause more bladder irritation. These are commonly called bladder irritants. Now, this is not an all-inclusive list, but a list of the most common items that we find men tend to grab. Now, this doesn't have to be an all or nothing approach. Try to limit bladder irritants to no more than 2 per day. Also, for every bladder irritant that you do have, you want to increase your daily recommended fluid intake by the same amount. An example of this is if you were to go have a 4-ounce cup of coffee, and if it's advised for you to have 64 ounces of water each day, with that 4 ounce of coffee, you would need to increase that 64 ounces to 68 ounces in order to combat that cup of coffee that you had. This will make sure that you are able to maintain a healthy bladder. Now, if you are bothered mostly by nighttime urination, consider reducing fluids in the evening after around 7 p.m. It's important, of course, to still keep your fluids up for the rest of the day, and be sure to empty your bladder completely before going to bed. One of the common errors that we see in men is not fully letting their bladder fill up before emptying. This in turn will create a cyclical cycle that triggers the brain into thinking you need to empty your bladder before you actually do. Now, one of the ways to combat this is actually by working on the pelvic floor muscle training to decrease the urge to go. Another common cause of excessive nighttime urination is swelling in the ankles and feet. This is a sign of decreased circulation, and if this occurs in you, you might find some relief if you can elevate your feet and legs above the level of the heart earlier in the day. This will allow the fluid to re-enter your body for circulation and allow you to pass it via urination earlier in the day when it is more convenient for you. Beyond this, you may need to discuss with your physician if any medications or changes to medications are warranted for you. Although it may seem that you urinate more at night, One of the reasons we find someone taking excessive trips to the bathroom is not fully letting their bladder fill up. This can be from going at the first sign of needing to empty your bladder, or it can be from a learned habit. One thing to note is the normal frequency is every 3 to 4 hours. That is only one factor though. The other factor is note how much fluid you are actually voiding. So the normal bladder can hold about 300 to 400 milliliters of urine, or roughly 2.5 cups. This will translate to approximately 21 seconds of a constant urine flow. Now understand that if you do have an enlarged prostate closing in on the urethra or scarring in the bladder neck that is causing some blockage, that may increase that total time needed to void. So in summary, there are incorrect ways and correct ways of dealing with an overactive bladder. The first and primary is taking a hard look at the lifestyle factors that are driving this condition. These lifestyle factors are best treated with behavioral modifications, including limiting excessive alcohol or caffeinated beverages. Now, it doesn't have to be an all or nothing approach either. We recommend trying to limit bladder irritants to no more than 2 per day, and for every bladder irritant that you do consume, try to follow that up with an equal amount of water in addition to your daily recommended amount.